From WRAL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Wednesday, June 17th, 2020. I'm Cliff Baumgardner. Here's the latest from WRAL.com. Scientific studies over the past 2 weeks prove that masks and face coverings are effective at preventing the spread of COVID-19. That's according to the North Carolina Department of Health and Human Services Secretary Dr. Mandy Cohen. Today, Cohen briefed lawmakers on new developments in continued coronavirus studies. Lawmakers had a chance to ask questions as they discussed new bills related to COVID-19. Cohen said she was concerned about the number of coronavirus cases in North Carolina, noting that COVID-19 hospitalizations have reached 849, the highest they have been during the pandemic. These are worrisome signs, Dr. Cohen said, but our fate is not sealed. There is a lot we can do. Cohen revealed the latest information researchers have learned about the coronavirus, including recent studies which have shown that face covers are effective at preventing the spread of the virus, and that research into a phenomenon known as super spreaders, people with the virus who've been known to infect upwards of 100 people at a single time, is underway. Cohen said officials are focused on educating the public and encouraging people to get tested. She reminded people to follow the 3 W's: wear a face covering, wait 6 feet away from people, and wash your hands. With this recent data about the positive impact of face masks in mind, many North Carolina counties and municipalities have begun debating whether to make them mandatory. And after briefly discussing the possibility in Wake County, officials have decided to let area cities take the lead on implementing such mandates. Greg Ford, chairman of the Wake County Board of Commissioners, raised the possibility of a countywide requirement on Monday, but yesterday he said there isn't unanimous support for a mandate among the dozen municipalities in the county, which could lead to public confusion and enforcement issues. Instead, each of Wake's municipalities has the local authority to issue a mask order within its town or city limits. About 83% of Wake County residents live in one of those 12 municipalities. In response, the Raleigh City Council quickly jumped to the head of the line and unanimously approved a revised emergency ordinance that would include a mask requirement. No start date was set for the requirement, but officials said it would be patterned after an ordinance already in effect in Durham County, noting the city would focus on education rather than enforcement. Earlier this week, Governor Cooper said a statewide requirement for everyone to wear masks in public spaces was in discussion, but no timeline or details have been provided as yet. And lastly, researchers in England say they have the first evidence that a drug can improve COVID-19 survival. A cheap, widely available steroid reduced deaths by up to 1/3 in severely ill hospitalized patients. The results were announced yesterday, and the British government immediately authorized the drug's use across the United Kingdom for coronavirus patients like those who did well in the study. Researchers said they would publish results soon in a medical journal, and several independent experts said it's important to see details to know how much of a difference the drug, dexamethasone, might make and for whom. But the bottom line is good news, said the United States' top infectious disease expert, Dr. Anthony Fauci, adding, quote, "This is a significant improvement in the available therapeutic options that we have." The study, led by the University of Oxford, was a large, strict test that randomly assigned over 2,000 patients to get the drug and compared them with some 4,300 patients getting only the usual care. The drug was given either orally or through an IV for 10 days. After 4 weeks, it had reduced deaths by 35% in patients who needed treatment with breathing machines, and by 20% in those only needing supplemental oxygen. It did not appear to help less ill patients. Researchers estimated that the drug would prevent 1 death for every 8 patients treated while on breathing machines, and 1 for every 25 patients on extra oxygen alone. Scientists want to make it clear that the steroid isn't a wonder drug, but it could play an important role in patients' recovery from COVID-19 going forward. This has been your Coronavirus North Carolina News Brief for Wednesday, June 17th, 2020. As always, if you enjoy the information and resources you get from this show, let us know. Leave a rating and review wherever it is you listen. And while you're there, don't forget to subscribe so you don't miss our new episodes. Thanks for listening.